All right. And you should all be seeing my screen. All right. Sounds like we have some people that may not be muted. So if you could just double check your phone and computer, make sure that you are muted. And we'll go ahead and get started. So just as usual, this call is for the schools and our health department staff. So everything will be posted on our website. So you can see all the information and the webinar within the next few days. So if you're not with the school or health department, we just ask you to drop off the call right now. And any information that you feel needs to be passed along to others in your organization, please see that it is. First thing, I just wanted to make sure people were aware that a couple months ago, an updated version of the Managing Communicable Diseases in the Schools was posted on the state website. The link is here. An easier way to find it is if you just go to mi.gov/CD info, as in communicable disease info, so CD info. And as you scroll down through the list, you will see it on that list. But there were several small updates made to it, but some are quite useful, like an algorithm for deciding when kids should be excluded from school, things like that. Overall, it is an extremely useful guide. If you have not read through it completely, I would really encourage you to do so. Anyone in your school that is in charge of, your absenteeism line, the call-in line for absent kids, reporting anything to do with sick kids, I'd really encourage them to read through it. It is not very long. Again, it has some really, really useful information. So I just wanted to point that out to you. It has a table in it that goes through pretty much every communicable disease, explaining how long it's contagious for, how long kids need to stay out of school, that kind of thing. So again, I'd really encourage you to look at that. The other thing, an email did go out on the 8th, just explaining how you can report how many of your rapid antigen tests have expired, because there's issues obviously with not getting more tests until you've used the tests you have, but if some have expired, there's issues with that. So this explains how you can go in and report them as being expired rather than being used, so that that'll be accounted for so that you can get more test kits. So this is an image of what that message was. And again, you should have gotten an email about that, but just in case, that information is here as well. Basically, you go in, if you're ordering them, you just put in the order amount at 0, and then you go down to items number 13, 14, and 15, and that's where you would put that information. And then just some updates on different things. One is that since we've talked last, the second booster has been authorized for a couple of age groups. So 4 months after the first booster dose was received, whether it was Pfizer, Moderna, or Johnson & Johnson, those that are 50 years of age or older may receive a second booster. So again, it's not a mandatory booster, it's an optional at their discretion booster. People that are 18 and older and are moderately to severely immunocompromised may get a second Moderna or Pfizer booster. Those that are 12 and older and moderately to severely immunocompromised may get a Pfizer booster. And just of note, the definition for being up to date on vaccines has not changed. So those that are eligible for a second booster do not have to have gotten it to be considered up to date. So some people have elected to do this right away. Some who may be healthier, but over 50 are kind of watching the current dashboards, or waiting to get that second booster before they go on a vacation, or again, if the incidents were to start increasing again or a new variant were to come around, that kind of thing. So again, it's not necessarily something that they have to do right now. I just want to talk a little bit about influenza because that is still around. It just has not been a terrible year, thank goodness. So right now, Michigan is in a minimal activity level. We do have some states that are dealing with quite a bit higher influenza activity. It is possible that we could still see worse activity. We're still mainly dealing with influenza A. Influenza B usually occurs more in the springtime, so it is possible, again, that we could actually see a shift and some more activity. So we will continue to keep an eye on that. Just as an FYI, nationally, there have been 16 children that have died from the flu so far this year. We haven't had any pediatric deaths in the state of Michigan, thankfully, this year. Just to kind of show you some activity throughout the country, there is a hospitalization surveillance project that monitors a certain number of hospitals to just keep a track on the hospitalization activity in Michigan. The counties of Clinton, Eaton, Genesee, Ingham, and Washtenaw counties participate in this. So all those hospitals provide specific data on lab confirmed influenza hospitalizations. So these different lines correspond to different years. As you'll see, this kind of army green here is last year. So it was pretty much just a flat line because we really didn't see much activity last year. The dotted black line is this year, so still pretty low, but we are seeing some activity. You can see different years where we've had varying activities at varying times of the year. So I just wanted to share that with you. In those specific counties that I mentioned, there have so far this flu season been 133 lab confirmed hospitalizations. 31 of those were in children. So again, it's just for those specific counties, but they use that to get an idea of what proportion of hospitalizations in the country are due to influenza. There have been influenza outbreaks in schools and other congregate settings throughout the state. This is just another way in which different regions are separated throughout the state. So north is the UP and the tip of the Mitt. Central is right through the central band of the lower peninsula. And that's how these numbers of outbreaks are divided up. So over the week of which this report was generated, this is the most recent flu report, there was one outbreak in the northern section of the state. So throughout this entire flu season so far, there have been 8 school influenza outbreaks, 3 in the central portion and 2 in the northern portion. So again, even though we've not had huge influenza activity, it still has affected some schools. There was a report that recently came out from the CDC just talking about 10 people that were confirmed. It takes a lot of really specific genotyping to confirm reinfection within 90 days of COVID. And just kind of looking at those 10 individuals, 8 of them were kids, 2 were adults. One of them had received the 2-dose primary vaccine, but had not gotten any boosters. 2 people had only gotten 1 dose, and the other 7 were unvaccinated. Most of them had a lot of exposure risks, whether they were at work or in school or even in their household setting. So again, just looking at that there are some individuals, this was people that were infected during the Delta variant time and then got reinfected with Omicron within a 90-day period. Obviously, it doesn't happen often, but just looking at this, the majority were unvaccinated or under-vaccinated. They had information on symptoms in 8 of those 10 people, and so 6 of those 8 people did have symptoms during both infections. So It's kind of confusing, but just a little look at that. This is information from a study that the Commonwealth Fund just published. They looked at the benefits that have been likely achieved by the vaccination program for COVID since it started in December 2020 through the end of this March. They estimate that around 2.2 million deaths have been prevented, around 17 million hospitalizations, 66 million infections have been prevented, and almost $900 billion of healthcare costs have been saved. So that's just kind of a review of some data and different things that have come up over the past month. The My Start Map info website still has your local data. They are still working on getting it or adding in the new CDC method of presenting data. And then of course the CDC has that data as well. Just showing some of the information that the CDC and the state does have available. This is for the United States. This larger graph is the last 6 months. And you can see that our tail here has just continued to go, but is staying low. And then this smaller inset here is over the entire pandemic. We have not quite gotten as low as we were back last summer. Again, that tail just kind of keeps persisting. We'll talk about that more in a bit. This is Michigan for the last 6 months, and then for the entire pandemic. And kind of similar where our tail just kind of continues to go, but we have been staying low till just the last week or so, a little bit of an increase. These are the community levels. Everyone but Washtenaw is in the low level. Our 19 counties are here. We have some that do have some higher community levels. Hospitalization levels continue to be quite low. I just wanted to share this. This is from the New York Times. They do have a nice data display, and probably many of you have been hearing this in the news. There are some states, these are the highest states with the highest data recently, or case counts recently, primarily on the East Coast. But we are starting to see some states that are beginning to see an upward trend in their cases. So you can see this little up curve, particularly Rhode Island is one of the biggest ones starting to see this. The axis here on the left is the percentage of cases compared to the peak in the highest level in 2021. So that's what that percentage means. But it still gives just a good comparison for trying to compare it all to sort of the same level. The orange line is the hospitalization levels. This is an interesting table looking at the wastewater monitoring in the U.S. One concern is that there just isn't as much testing of people going on right now, and a lot of it is home testing, which is not counted in those numbers that I just showed you in those tables, whereas testing of our wastewater can pick up changes perhaps sooner than we would see in testing of individual people. So this dark blue line here is the wastewater levels of COVID, and the blue line here, the lighter blue line, are the average case count lines. The bar lines here are the daily counts. So similar to the graph I just showed you. So you can see how the wastewater kind of increases before we see the increase in the individual case counts. So again, it may be a leading indicator of when we're going to see a surge. So I've blown up, this is a 6-month image here. This inset is a 6-week table. And you can see how the wastewater is starting to increase, whereas the individual cases are staying pretty stable. So again, a concern that we are likely about to see another increase. This is from the state report from this week. They didn't have kind of those individual case count graphs, which is why I had inserted those separately. But for our hospitalizations, they are quite low, again, perhaps starting to level out here, and same with our ICU levels, look like they're leveling out. Same with our pediatric hospitalizations, very low, but look to be leveling out. They did have a nice update on the multi-inflammatory syndrome in children. As we've mentioned in the past, that usually occurs several weeks to even a month or two after someone is infected with COVID. So, we may still see cases occurring for the next several weeks, even though our surge has passed. But you can see this large clump of cases that we've had here in the past few months. This is actually where my cursor is right now. This is December 19th. So this is really from the surge we had in the fall. Unfortunately, we still have, we are likely to see another surge of these cases from this Omicron surge that we had. So just to kind of give an update on that. This is a little busy. I've done some cutting and pasting here, but this has to do with the BA2 subvariant of Omicron. From this prior week up to April 9th, the US as a whole had about 86% of the variants that were subtyped came back as the BA2. So that's this lilac colored band here, represents 86%. And then you can see the size of that band, kind of how it's increased from March 12th on up. In Michigan, they're commenting that since March 4th, about 500 of the 3,000 variants that they've sequenced have been BA2. However, if you look at the visualization here, this is from March 9th kind of to the beginning of April. The red portion of these lines is the BA2. The green portion of the line is all the rest of the Omicron variants that are not BA2. So you can see that over the last several weeks, nearly all, if not all, of the typing they're doing is BA2 now in Michigan. So if you go back to March 4th, it's a little different, but if you just look over the last several weeks, pretty much most, if not all, again in this last week of the testing they've been doing has been BA2. So when we're looking at the BA2 subvariant of Omicron, it does have additional mutations. It's a bit more transmissible than the original Omicron. The vaccine with the booster seems to protect as well as it did against Omicron. It seems to cause more mild illness like the original Omicron variant did. And it does appear that reinfection can occur, although it is pretty infrequent. So what they're seeing in this map here, the dark purple are counties where it does appear like case counts may be increasing, and the lighter, kind of the medium color purple, cases seem to be more at a plateau, and the light purple, it seems that cases are still decreasing. And this data only goes through April 3rd. So, things may be a little different now. Based on the trends they're seeing in Michigan, this is what they're projecting our BA2 surge to look like. So really not a huge surge, more of a bump. And that's a lot of projections have really foreseen that the BA2 situation in the US may really more than anything just cause this tail from our Omicron surge to just be longer. You know, it's going to take a long time for this to go down any further. And again, it may cause this bump here, kind of like we're seeing in other states where they're having a little increase. So we'll just keep a close eye on it. But it's a good time to really remind families that COVID is still out there, what the symptoms are, that BA2, if people get sick with COVID, it is most likely the BA2 variant, that is slightly more contagious. You know, just really bring this back to the forefront for people that this is still here, this will continue to be here, and, you know, just have that reminder for everyone. So because things seem to be evolving, my thought was that we could have our next meeting in 3 weeks. So on May 5th, you know, I don't really foresee any major policy changes or changes in recommendations. For the most part, in all of our counties that I've looked at, things are very stable, and some are continuing to decrease. If anything, maybe slight increases. We can meet sooner if there are any issues, but I think 3 weeks would be appropriate unless anyone has any other opinions. But let me get us back. All right. So if anyone has any questions, there's actually no questions in our chat right now. So if anyone has any questions, feel free to post those, or you can go ahead and unmute yourself and just ask. All right. If anyone wants to meet sooner than 3 weeks, let me know. But I think, I mean, especially since there's really no questions today, I think 3 weeks is fine. If there's others who feel like we don't need to meet anymore, I mean, we can discuss that too. But I figure if you just don't need to join if you don't need to meet. But all right. Well, we will get the slides and the recordings out. As usual, if you have any questions or concerns, then give us a call. And you have your HRAs and your local communicable disease nurses as well. Again, I really encourage you to check out the Managing Communicable Disease link, and we'll try to get that sent along again just as a reminder. We'll see you on May 5th, and have a great holiday weekend.